Hello everyone. On behalf of Dr. Alop, we are going to talk today about alopecia areata. What does alopecia areata mean and why do we lose our hair? Well, alopecia areata is the spotted hair loss from a body site, for example scalp, face, arms and legs. If you experience this type of hair loss, don't worry, because your hair can grow back. Alopecia areata has different names based on where the spots of hair loss are located, which can be quite confusing, but I will help you make it clear right away. When hair loss is located on the scalp, this is called alopecia areata. The same name applies to the loss of eyebrows and eyelashes. If you are old enough and you grow beard and mustache, but you lost hairs from that area, then you have alopecia barbae. When all of scalp hair is lost, the condition is called alopecia totalis, and if body hair is involved then is called alopecia universalis. But why we lose our hair? You might have already read that alopecia areata is an autoimmune disease. This means that your defense cells attack your hairs, causing them to fall. Defense cells belong to your immune system. So in order to understand what is an autoimmune disease, you need to understand what is an immune system. Well, immune system is a part of our body that protects us against invaders. It involves the recruitment of cells that behave like soldiers, and are trained to identify invaders, and distinguish them from your own cells. Therefore, these soldiers learn to attack only foreigners and not your body. Let's see briefly how immune system works. You have soldiers, like this happy hornet, that attack bacteria, viruses, and other parasites in order to keep you healthy. What is important is that these soldiers recognize and attack only the invaders without causing any damage to your body, leaving you happy and healthy. But how is our immune system able to do that? Well, immune cells undergo a tough training course during their development, and, if they are successful, they are allowed to go fight any potential invaders. However, if you are nervous all the time, if you have family problems, school problems, fever, cough and runny nose for long periods of time, or you have dry skin, and you feel always tired, you may produce immune cells that are doing bad in school. So, these cells from happy hornets become angry hornets, and as a result, they are not very good in distinguishing which cells belong to your body, and which don't. Therefore, these cells may attack not only invaders, but also your hairs, causing them to fall. Let's take a look at one example. This is a hair follicle. Let's call it Bob. People, say hello to Bob. Bob is not alone. It comes with a muscle, called erector pili for movement, has a sebaceous gland for lubrication, and a group of cells, called stem cells. These are responsible for producing a new hair when the existing hair falls. So, one day, Bob is approached by lots of angry hornets. They think that Bob is an invader and attack it, so Bob falls off the body. Fortunately, as you have probably noticed, stem cells are not attacked, therefore, when the angry hornets go away, a new hair can grow back. But hair may not always fall. Let's look at another example. Here we have 3 healthy hairs. They are once again attacked by angry hornets. They fight strongly, and as you can see, they do not fall. However, they are injured, so they look like exclamation marks, are cut short or simply broken. Of course, all these changes can be seen on your scalp, and here are some typical photos of exclamation mark hair, cut hair and broken hair. Okay, now you know what happens to your hair, but how can your hair become healthy again? There are more than 50 different treatment methods that have been used so far. They can be in form of creams, pills or shots. Depending on your age, on how much hair you have lost, and on what you have already tried, your doctor will pick what is best for you. How do they work? Well, most treatments, for example corticosteroids and phototherapy, work by reducing the immune cells. Therefore, when we apply or inject these drugs, they get absorbed from your skin and kill the angry hornets, letting your hair free to grow. But not all treatment work like that. For example, immunomodulators such as diphencyprone work in another way. When we apply the substance with a cotton stick, it gets absorbed from the skin and causes some small reaction. Your scalp may look red and feel itchy. This brings happy hornets to your skin, which fight with the angry hornets, and make them disappear, leaving your hair healthy. What is important for you to know is that not every treatment may work for you. But if one treatment does not work, do not worry, you can try another one. In addition, several new treatment options are currently on their way. That was the end of our story on alopecia areata today. Hopefully, you have now learned what happens to your hair, and how treatments work. You hairs are strong fighters, but we sometimes need to help them fight against the angry hornets of your body. And don't forget, if you liked this video, and you want to see more videos on alopecia areata, please press like and subscribe. Until the next video, take care and see you soon.